A lot of people from overseas come to our clinic to get a hair transplant done. The technique that we are doing here, which is the Bio-IPT technique, is a unique technique in which implanter pens are being used and the entire surgery is being done by a doctor. This is a unique technique which is done by very few clinics across the world, which is why we have so many people coming into us for a hair transplant. So in today's video, I am going to explain all the steps that you have to take if you are living out of India and you want to get a hair transplant done at our clinic. So the first step is that you need to send us your information on either mail or our WhatsApp number. Once we receive a mail from you, our team will get in touch with you regarding your photographs and my expert will speak to you regarding your condition of hair loss. Once an expert from our clinic gets in touch with you, he or she will question you about your kind of hair loss. Since how much time the hair loss has been happening, whatever treatments you have taken. We will also be asking for your photographs to analyze how much hair loss has happened. According to that, we will be suggesting you a treatment plan. So once my expert gets in touch with you regarding your condition of hair loss, then he or she will schedule a consultation with me. The consultation will be done online either through Skype or a WhatsApp video call. In the consultation, we will be discussing everything about the hair transplant. First of all, we will be devising a plan for you, a treatment plan in which we will be estimating a number of grafts that you require, and further what will be the treatment plan for you in terms to save your existing hair. So we might be suggesting you certain creams, certain lotions or certain medication to save your existing hair along with certain GFC. In the online consultation, I will be explaining to you the entire process of the hair transplant, what are the pre-surgery steps that are taken, what are the precautions that are taken, what are the blood tests that have to be done, how the surgery happens and what is the healing period. So in the consultation, I generally explain to my patients what is the kind of time that they have to be in the country. Because generally next day of the procedure, we remove the bandage, we wash the donor area. After 2 days, we wash the recipient area. So we advise our patients to stay for around 2 to 3 days. However, 1 or 2 days is an absolute minimum. After that, they can fly out. The total healing period is around 10 days, but that is not the duration for which they are required to be in India. They can be here for around 2 to 3 days. Once I have explained to them the entire pre and post surgery steps and the healing time that is required, my counselor will again get in touch with them and help them book their transport in India as well as the accommodation. He or she will also give them flight options so that they have absolutely no problems in staying in India. During the consultation, we discuss the number of grafts that are required to be done for the transplant. This graft number is an estimate. So depending upon the graft number, either 1, 2 or 3 days are booked for the person. Once the days for the surgery are finalized, the patient can go ahead with booking his flights and accommodation near our clinic. We generally advise our patients to come 1 day prior to India and meet us a day prior to the surgery so that we can see him or her live in front of us. We can assess the scalp. We can do a trichoscopic evaluation of the scalp as well as the donor area. In such an evaluation, we get an exact idea of the number of grafts that have to be done. We are also able to understand what kind of donor area he or she has. Just in case we feel that the scalp donor area is not good enough or not sufficient, we can also plan body hair extraction. So the exact surgical planning is done when the person is in front of us a day prior to the surgery. After the surgery, there are certain instructions that the patient has to follow, such as spraying a saline spray on the implanted area, taking certain medications. So the entire post-op kit is provided to the patient from our end. Also the medications that he or she might require in the next 1 month are also provided from our end. Generally the saline spray that has to be done for 2 days. So in case the person is traveling within these 2 days, it is advisable to carry a small 100 ml normal saline pack which we will be providing so that it is easy to carry in the plane. For all our patients outside Delhi, we always provide virtual consultations after the hair transplant so that we can follow up. My number as well as the counselor's number is always available to all my patients so that in case they ever have any doubt, I am very much reachable. So if you're staying overseas and plan to get a hair transplant done with us, I hope this video solves all your doubts. If you like my video, do share with your friend and family and do not forget to subscribe to our channel. Thank you.